I'm Richard Thompson. I'm a consultant surgeon. For Phoenix, I've been involved with the Allurion program for about 6 months. The Allurion balloon for me is unique in that the beauty for us and more specifically for the patient is that it's completely, essentially procedureless device. Because it's made of a different material than other historic balloons, it can be put inside a capsule, which can be very easily swallowed, so you don't require any surgical procedure, don't require any endoscopic procedure in order for it to be placed. The patient simply swallows it themselves. So to me, that's a really attractive option for the patient because they're in control and they don't have to have anything invasive done. This is the Allurion balloon capsule and the filling catheter. We try to avoid touching the capsule itself, but just by holding the catheter, if they place it to the back of their tongue, and then with a series of swallows of water, they're usually very successful. And then once it passes down into the stomach, and we can measure that by these little black lines on the insertion catheter, then we take an X-ray to confirm that it's in the correct location, and then we simply hook up the catheter to a bag of fluid, and that runs in over about 5 or 10 minutes and just gently and very slowly inflates the balloon with 550 mils of fluid, which sits in the stomach. The capsule itself will just break open once the fluid starts to fill. And then we take another X-ray just to confirm that it's successfully filled. This is the final outcome, so the duration of the treatment, which is 4 months. And then after that, we know that the little membrane spontaneously opens and then deflates. The Allurion program is for anyone who struggles with excess weight or obesity. The BMI criteria, if we look at it strictly, anyone with a BMI of 27 or above, but it's particularly for those patients who want to kickstart their weight loss, who've maybe struggled to have any success with weight loss in the past, but who don't want to go down the option of more invasive techniques or procedures such as surgical procedures, and want to have that non-invasive tool to help them kickstart their weight loss. We look at the thousands of balloons that have been inserted across the world. We know, looking at the studies, that the average weight loss with the Allurion program is 10 to 15% of your total body weight. The motivation for a lot of the patients that I've seen so far has really been to help them, to motivate them to make some changes to their diet and their lifestyle, and to re-educate themselves in terms of how to eat in such a way that will promote weight loss. And the balloon is a tool which will allow them to do that. And in addition to the balloon, of course, they receive the support from the dietitians and the nutritionists and the bariatric nurses in order to help educate them and help them achieve the maximum weight loss possible for them. And then to maintain those more healthy habits towards eating and lifestyle going forward once the program has ended. So that's the motivation for a lot of patients, really, just to help kickstart their weight loss. But of course, it's not just about weight loss, it's about health gains, comorbidity reduction as well. So any significant weight loss we know will help in terms of overall health and reduction in comorbidities in the future. It's a very common story is women who struggle with issues related to their fertility, and that can often be the case and related to excess weight. And again, anything that can allow them to achieve clinically significant weight loss can improve their fertility outcomes as well. In total, the Allurion program for the patients is a 6-month program, starting from pre-insertion of the balloon, with the counselling beforehand and the education with both the surgeon inserting the balloon, so myself, and the nutritionists and the dietitians, in order to educate the patient about the experience and about the aftercare. Then the balloon itself will last for 4 months, and then there will be a further 2-month follow-up for the patient thereafter. That will be the standard 6-month program. The balloon is there as a tool to help you make changes to your diet and lifestyle, and to encourage you to continue that even once the balloon has gone. We know that that's pretty good outcomes in terms of the the maintenance of weight loss even once the balloon is no longer present.